Hey there, Katya. Thank you. You know, for many of these patients, Driscoll Children's Hospital becomes a second home. A lot of families having to travel from out of town, as is the case for 9-year-old Romeo and his family. Take a look. This is his story.
Since the very first surgery, he's had this specific bear with him through every single surgery.
15 surgeries, his first when he was just 4 months old.
Of course, a scared mommy.
Romeo Pena was born with a cleft lip and cleft palate. His mom, at first, was worried about what kind of life he would have.
It was actually a pretty severe cleft. The opening was pretty big, and he had no palate at all.
Fears that were quickly put to rest by the continued care he receives right here at Driscoll Children's Hospital.
At Driscoll Children's Hospital, we have the only cleft lip palate treatment center and for craniofacial deformities here in South Texas.
Romeo's doctor, Kevin Hopkins, developing a bond with his young patient, saying it is his great spirit that stands out.
Your heart goes out for him because you just want everything to be perfect for him, but even knowing that he's got a hard road ahead, he's just got a great attitude.
Complicating his condition, Romeo also suffers from ectodermal dysplasia, something that keeps him from sweating and delays healing, making his case unique.
With him, it's almost like one step forward, 2 steps back at times because of the healing things with him. But each time we do see improvement.
My mom, she's always here for me no matter what.
A brave little boy who, despite everything, continues to try and live a normal childhood.
He's straight A. He doesn't get into any trouble. He's very respectful. He's very loving. He loves his skateboard.
His family embracing his condition.
So I have his chicken footprints, 15 chicken footprints for every surgery he's had.
Tiny chicken feet, a part of a nickname that stuck with Romeo.
You saw the side profile. His nose looked like a little beak, and my mom started calling him pollito, which is, chicken in Spanish.
Sometimes it could be okay, sometimes it could be awesome. I like it.
And while Romeo will require future surgeries, his mom is forever thankful for the care and treatment her son has received.
He's come out great. He's done great with all his surgeries, and he's happy with himself, and that's all that matters. Thank you, and they're a blessing, and they've taken care of my baby so well.
And we're joined now by Romeo and his mom, Tina. Thank you so much for being out here today. His condition really is unique, as we just saw in that story, to where on top of having the cleft, he can't sweat. How difficult is that, especially to be outdoors like we are today?
Well, we always have an ice chest with us with bottled waters, cool towels, extra shirts, because we get him all wet all the time. It's just thinking about his safety first all the time.
15 surgeries. How tough has that been on your family?
It actually is harder for him, for us to be strong for him. We just take it day by day with him.
And what would you like to tell the folks over at Driscoll Children's Hospital? We have his doctor here since day one, Dr. Hopkins. What would you like to tell the folks over there just about their treatment?
They've been great. I would like to tell them thank you. They've treated my child to the best of their ability with every single surgery, and he's come out great.
Romeo, what do you think about your doctor over here?
I think he has made me the way I am now, and it's awesome because I wouldn't have been here.
He's a good guy. Dr. Hopkins, can you talk about how unique his situation is?
He's got a combination of a cleft lip and a cleft palate, which is about 1 in 600 kids, but it's compounded by the fact that he has this ectodermal dysplasia, which is really like 1 in 100,000 kids. So it's pretty unique and pretty rare.
Yeah. How important is it for people to call that number 694-5900, to call in and donate to Driscoll Children's Hospital?
It's huge. The more money we have, the more we can do to advance care for children, especially with multiple problems like Romeo here, and really help them out. So we have all the specialists wonderful doctors at Driscoll Children's Hospital. The money's really, really going to a good place. It's helping the kids. About every money, every cent goes to our kids. Yeah.
You know, we heard a little bit of it about it in the story, but how common of an issue is this?
For cleft lips and cleft palates, it's the second most common congenital condition secondary to heart disease. So that's pretty common. So it's affecting, could be your neighbor or your grandson or your child. It's pretty common in the area. Yes. Yeah.
Thank you so much for being here. We appreciate that. Romeo, thank you for being here, and we have something for you. I'm going to put this around your neck. There you go. This is for being one of our miracles. Thank you so much. And we're going to go over to Katia right now. Hey there, Kat.
Ay, Pollito. I love his story. It's a great story. Thank you for that, Bill. I appreciate it.